Okay, I'll let everyone in, so I'll be respectful of our time. Welcome, everyone, to Equity in Birth, Reimagining Maternal Care for Black Women. I am Nicole Kmack, and I am the chair of our Journey to Wellness Committee of the Washington, D.C. Alumni Chapter of Delta Sigma Theta Sorority Incorporated. And so I would like to welcome you all to this event. Just to give you a quick overview of the day, we will have a brief emergency message from our second VP, Dr. Erica Scavella Hill, followed by a welcome by our first VP, Tamara Wells Lee, and then we'll jump into the panel discussion today. And so this discussion and program will be around an hour, so we'll have time to hear from our panelists, and then we'll leave time at the end for question and answers. So I will turn it over to you for the welcome or for the emergency preparedness.
Thank you so much, Dr. Kmack. And I know Dr. Relaford is on as well as the chair and co-chair of the Journey to Wellness Committee. I'm going to give a very brief emergency response team safety message. Sorors and guests, in any location in which we meet to conduct Delta business, we must be Delta ready. Please take the time to identify 2 exits in your current location in the event that you need to evacuate. It is raining here where I am and storming, so please be prepared in case you need to evacuate. It's important that you know where those 2 locations are located. That is the end of the emergency safety message. Please stay ready, be Delta ready. Back to you. Actually, I'm going to hand it off to our first Vice President, Ms. Wells Lee. Thank you.
Thank you, Dr. Scavella Hill. Good evening, everyone, and welcome. Again, I'm Tamara Wellesley. I am the first Vice President of the Washington, D.C. Alumni Chapter of Delta Sigma Theta Sorority Incorporated. And on behalf of our dynamic chapter president, Nicole G. Jordan, and our nearly 540 members, welcome. We are proud to present Equity in Birth, Reimagining Maternal Care for Black Women. And this is really going to be a conversation grounded in truth, grounded in urgency, and the pursuit of better outcomes for Black mothers and Black families. I would like to extend sincere appreciation to our wonderful Journey to Wellness Committee under the overall leadership of our second Vice President, Dr. Erica Scavella Hill, and just thank them for their thoughtful planning of this program and for the important work they continue to do in leading and advancing health and wellness within our chapter and more importantly within our community. And I also would like to thank our panelists and our participants who will engage in this important dialogue and share their insights. We are grateful to each of you who have joined us this evening. Your presence certainly reflects a shared commitment to understanding advocacy and change surrounding this important topic. So at this time, I invite you to settle in and listen and engage fully in tonight's discussion. And I'll turn it back over to Dr. Kmack.
Thank you both so much for the opening and for the emergency message. I would like to start off by just doing a brief introduction of our panelists. I am excited about all that they will bring to the discussion today. So I will start with Erin Clark. Erin is a certified childbirth educator and doula with over 8 years of experience serving families throughout the DMV area. Having attended over 130 births, she primarily supports hospital births while also holding space for families choosing home birth. As the founder of Doula EAC, Erin provides a luxury in birth experience and believes that everybody deserves a doula. Her approach blends evidence-based education with hands-on nurturing care, guiding families through pregnancy, birth, and postpartum with confidence and intention. Welcome, Erin.
Thank you so much for that beautiful welcome, Nicole.
And next, I would like to introduce Aaliyah Walker. So Aaliyah Walker is a mother of 3 beautiful young daughters, a 3-year-old and 1-year-old twins, and a powerful maternal health advocate whose story of survival has inspired millions. And I am going to leave that part open so that she can share her birth experience with all of us today. But what I will tell you is that determined to turn her experience into impact, she began sharing her story across social media reaching over 10 million viewers worldwide and appearing on multiple news platforms. Today, Aaliyah is a passionate advocate for maternal health, focusing on raising awareness about pulmonary embolism risk, particularly among pregnant women and the Black community. And so, welcome, Aaliyah. I am so happy to have this conversation and to have you to be a part of this discussion, giving us both the perspective of a doula who helps support births in all the ways, and Aaliyah having your lived experiences as well. In preparation for this, there is so much data when we look at Black maternal health, is particularly among Black women in the US. Okay. And so there is data connected to the increased risk of maternal mortality among Black women. There are also Black women are over 3 times more likely to die from a pregnancy-related cause than white women. And one thing that stood out to me is that the CDC reported that more than 80% of pregnancy-related deaths are preventable. And so this is just giving light to why this discussion is important and all of the intersections as we think about maternal health care, we think about the medical system, our health care, and even from a perspective of the program we had this weekend as we talked about medical mistrust. So I want to start it off, and either of you can start with responding to this question. But when we talk about Black maternal health disparities, what does that mean from your perspective and from your experience?
Lee, go ahead.
No, please, you go.
Oh, it's happening. Okay, here we go. Um, when I hear Black maternal health, I think of the people that I interact with every day. So I think of my clients. I think of, you know, I think of going into birth spaces and having the education and the protection and the confidence in providers that I trust. Um, Giving birth is scary. Giving birth is also beautiful. Um, People, I spend months with clients, um, creating birth plans, educating them on everything that they need to know, and preparing us to go into the space. And it often feels like going into battle. Um, so once we get there and we have the plan and things are going great, it's wonderful. But on those days when things aren't going so great, that is when I am reminded of the scary statistics and the reality that is Black maternal health. The reality is that Black women aren't being listened to. They're not being properly diagnosed when things are not going well, and people feel uncomfortable bringing up issues. And also, we're just not as educated about childbirth as we need to be. I tell people all the time, we are not taught how to have babies, and we're not taught how to grow food. So when we go into these spaces to have babies, we don't know what the warning signs are. We don't know that our blood pressure could rise, you know, slowly but surely, and we don't know to look out for that. And we don't know that we can have preeclampsia after we give birth. So, 2 weeks later, when your legs are swelling up, you don't know that you need to go back to the hospital. You think everything is done, you did it, you made it, but you don't realize that there's more to the story. So when I hear the statistics, it's a lived experience for me. Like, I am constantly keeping people safe, educating them, that way they know what they're dealing with when they go to have a baby.
I think to Erin's point, so much of someone who is not in the field and just a person existing and living their life and going through pregnancy and childbirth, I thought previously that many people were like me in, okay, I'm going to have a baby. It's going to be amazing. It's going to be beautiful. But yes, there are those scary components. And you don't really think about those until you get closer to giving birth. I think for me now, when I think about Black maternal health, the biggest thing that comes to mind is education. Similarly to what Erin said, we don't know the risks and we're not told the risks. There are some doctors that they are kind of fear mongers themselves, so they're going to make you aware. But I've come to find out that for Black women, you're not always presented with all of the facts, the stats, or the information that you need to make decisions for yourself in settings like that. So you go in either putting your full trust or your partial trust into these people that, if you're not in our area or areas like ours, might not look like you. And that's a really hard thing for a lot of us to do. Um, so when I think about Black maternal health on the global scale, I think about having people who look like us in positions like Erin, and in positions in the hospital where they can support us in ways that we did not know we needed the support.
Yeah, I want to add on is like people, we also, a lot of Black women that they get pregnant, they're so excited, it's so beautiful. The mistrust of the medical system has led people to find their own way through birth. I have a client now who has this idea that she wants to free birth. For those that don't know, free birth is where you may do prenatal care, you may not, and you plan to give birth on your own without a medical professional. Meaning, you like she's gonna have a doula, I'm gonna be there, but there's not gonna be a midwife there, there's not gonna be a doctor there, which is very dangerous. It can be. I trust birth, but I also know the steps that have to happen to keep you safe afterwards. And we had a meeting recently, and I had to explain to her, hey, I hear what you want to do, but I want you to also understand these are the things that have to happen after you give birth to keep you from bleeding out. And I can't do any of those things. So, we spent a long time talking about this, but it all comes back to her mistrust of her first experience of having a baby has led to this mistrust where she doesn't want to go to the hospital. She wants to stay home. But by staying home, she puts herself in more danger without having a medical professional. So yeah.
Yeah, it's the mental barriers that we create, I think, as we live our normal lives and go through the medical systems, that when we are experiencing these grand, grand things like childbirth, we say, I don't know if I want to involve anybody else because I have been scarred and hurt in the past by
Yeah.
these same systems. So it's
And
understandable.
you're willing to risk it all,
Right.
because you have this deep mistrust in
Hmm.
in the medical system, and you have trust in like your doula, like, and
Right.
I love that she trusts me, and I love that I'm going to slow walk her into like understanding.
Hmm.
Hey, this is the risk you're taking. If you're cool with that, that's great. It's not my job to make the decision for you, but my job is to make sure that you are educated and you know the risk that you're taking.
Absolutely.
Yeah.
So there is this piece where we think about like education, both from like mothers going into this process and not like there are some things you just don't know until you're in it. And then I imagine there's this responsibility from the medical side where it's like, are you educating mothers to be prepared for, or people for what to be prepared for in this process? What are some other things that contribute to the medical mistrust that we're seeing, particularly in the maternal health area?
The horror stories, and rightfully so. First of all, I tell people all the time, you go to, you're pregnant, it's so exciting, it's so beautiful. You go to the doctor and they're so exciting, everybody's so great, everybody's so loving, the nurses are wonderful, the staff is great. But then about 3 weeks before you give birth, these same people that were so loving and so trusting, turn into these fear mongers. And it's not, doctors and nurses are not out to get you, they are at work. They are at work and they are doing their job and they are covering themselves and they are risk adverse. So, because they have seen so many crazy things when it comes to birth, they bring all that in the room with them and they go, oh, by the way, if you don't give birth by your 40th week, your baby can die. And it's like, whoa, whoa. So, what happened to the happy go lucky people that were in here that I love so much? It, it, it becomes a fear based exchange, and we have to combat that with education. We have to teach people the facts of childbirth and what it's supposed to look like and what it can look like and what you can achieve, and you need to have that education. That way when they fear monger you like, okay, actually I have the facts and I can present them back to you, and I don't have to feel so afraid of what it is you're saying to me.
For sure. I think in addition to that, like that is very much relevant and so real to like today's context in a crazy way. But something that I thought about after my entire situation, um, is just the historical context of it all. I think some people have mistrust without even having an experience that was too bad or too shaky, and they don't understand why. And I think looking at just America, I'm not American, I'm not from here, but mistrust medically in the Caribbean based on history, like those things are very real. And it's the experiences that we have heard and that have been passed down to us that we don't fully know has ingrained itself in us to say, okay, great, I'm never going to put myself in that position, therefore I won't have the trust to begin with to even be in that. So I think for a lot of people, it's okay, that happened to my mom, so it's not going to happen to me. I'm not going to allow it to. Or I've heard this story of how my family was impacted in this way, and I'll put that barrier up so it's not happening to me too.
Yeah.
And
And
I,
that happened to my friend. And I don't want it to happen to me. And this is how people come into the birth space, like so afraid of C-sections or Pitocin,
Mhm.
things like that, because they're like, oh, all my friends have had C-sections and it won't happen to me.
Yep.
Not understanding like your friend might have had an emergency
Right.
where, they needed a C-section. It might have saved their life or it saved their
Hmm.
baby's life. But it's scary to hear it's scary to hear the horror story from your friends and your family and your mom. But when it starts happening to you, you realize like, oh,
Yeah.
this baby wants to come out through the sunroof. Got it. Like, there's no other way. Like, if we all want to go home today, we gotta open this up.
Yep.
Yeah.
Aaliyah, I mean, you mentioned a part of your birth story, so I feel like this will be a perfect segue. Could you share your birth story and sort of like what led to your medical emergency?
Absolutely. So I had one baby prior. She was a Sickleton, and it was a very normal pregnancy. So when we found out we were having twins, it was a very exciting process, and we were just ready. Yes, that concern was in my head of they're gonna come out of the sunroof. And I just know that to be true because I was always smaller and I carried big. And having twins, they were gonna be big. So everything was great through majority of the pregnancy. Towards my third trimester, I was itchy. I was so itchy, and I was hesitant to say anything because I was like, "This is not normal," but maybe it's just a me thing. And this again goes into us as women and Black women in particular, minimizing ourselves in some spaces because it's more convenient to do that than draw attention to ourselves. And I sat in the doctor's office one day wanting to say that I'm ready to itch my belly off and not saying it. And my husband chimed in and said, "Hey, she's also itchy, like really itchy at night." That statement in itself led to them finding out that I had cholestasis, which made me head straight to the MFM for regular weekly appointments. And it was in those appointments, the last one that I had, we found out that baby A, Aurora, was low in amniotic fluid. Baby B, Orion, had a heart murmur. So I am panicking in that moment, and the decision was made to have a non emergency section that day. So our life was kind of thrust up in that moment. And I think I'll preface the rest of the story with I suffered and still suffer from ICU delirium from the ordeal. So everything that I'm sharing with you, I have been filled in on by my husband and the rest of my family who lived through all of it. And I just kind of have the pieces of it. So, according to my husband, we got to the hospital that night and they took me back. Everything was going as it should. The babies came out, and after baby B came out, I seized, and essentially the pulmonary embolism had occurred, and I had a blood clot that moved into both my heart and one in my lung, and I was gone for about 5 minutes until they were able to bring me back. At that point, I was bleeding so severely, I was hemorrhaging, and I had to be flown from John Hopkins, no, Sibley, I'm sorry, Sibley to John Hopkins. So I was flown, then I was in the ICU for about 9 days, and I was intubated for those 9 days. The reason they flew me to John Hopkins is because the clots were in my heart. They assumed that I would need open heart surgery to clear everything up. So during that time, again, I am kind of in a vegetative state at this moment. I don't know what's happening, and the ICU delirium really kicks in once I do wake up. So my understanding of that entire process was our care teams, both at Sibley and at John Hopkins, were incredible. And again, I attest this to us being in the area that we're in. We had so many people that looked like us, talked like us, just wrapped their arms around our family and me in ways that I could not even imagine people doing. So while my husband was at the hospital with me, my family was at Sibley with the twins. The care team there set up calls for them to see the twins constantly. There was a point where they were stable enough to be sent home, but even if they weren't sent home, they wouldn't have been sent home with dad because he would not leave my side. So they made special allowances to keep the twins in the NICU and call us and do all of the amazing things that they did for us there. Meanwhile, Brady was at the hospital with me on rounds with the doctors, having discussions about what was going to happen next. And like I said, their plan was open heart surgery. And there were multiple scans that were done, and they finally decided, okay, we're going to have to do it. We know that she's young. We know that she might be able to, the clot may, dissolve on its own. However, we don't know if we have the time to take that chance. So the day that I was scheduled for open heart surgery, I cried when I heard this story. The doctor came in and said, let's just do one more scan. They did a scan, and my clots that had not changed at all over the course of the 9 days and then the 8 days, they had shrunk by 50% just out of the blue. And that was enough for them to say, okay, she's clearly fighting it. Her body is doing what it's supposed to be doing. We are going to give her the opportunity to come out of this unscathed, because if I had open heart surgery, they told Brady, I wouldn't be the same. Certain things might not work in the way they worked for me prior. So they were waiting it out, and eventually I awoke from my medicated, slumber, and suffered immensely. Since I was intubated for the entire time, I had vocal cord paralysis. I couldn't speak, and then I was so dazed and confused. The care team did an amazing job of slowly letting me know everything that happened. They were so scared that I would panic and kind of go into a frenzy that the day I woke up, I think I had told them, well, I tried to get up. I tried to get up and walk away, and I told them I'm supposed to be at the mall. So they eased me into the fact that everything that happened. Um, and after that, it was a crazy process. It was them explaining to me that you pretty much died on the table, and we had to fly you here to save you. Your twins are okay. I don't even think I asked about the twins. I didn't even know that they were a thing until someone told me my twins were a thing. And then it was a really big effort to get me to be able to talk and walk and eat and drink again, because I was being fed through a tube and being taken care of by an amazing team of people who never stopped fighting for what they thought my body could do. These people had never even spoken to me, and they just knew that it was something that I would be able to pull through from. Post everything, I was still dealing with a lot of bleeding because I was still open from the C-section. I had to have a wound vac put in to help to close that up and get me ready to go home. So I went home with a wound vac and just feeling very subhuman as a woman and as a person. But when I tell you the team that they had arranged to see me at home for PT, for wound vac care, just caring and amazing people who didn't even bat an eye at my open incision or anything that was going on with me, I don't think I could have gone through what I went through in any place other than Baltimore and Washington, D.C. I don't think I would have made it. I don't think I would have had the people who were patient and willing and understanding enough to see my situation through in the way that they did. I had so many doctors, nurses, and practitioners attest my blood clots drinking solely to something supernatural, and I can't say that they're wrong. So that's our story.
My goodness. Thank you for sharing.
Absolutely.
I read your story, but I didn't know your story. And just the idea of having so many people around you. You said multiple times that like fought for you, that advocated. And someone said in the chat, like having a support person at those appointments matter. Like your
Yes.
husband being there and you describing like he's on the rounds with the doctors, like them knowing you have this support around you and seeing you as a person. My
Yeah.
goodness, thank you.
Thank you. Of course. Of
Yeah.
course. It was a time. It was truly a time. I think uh, throughout the process of coming out of it and then, you know, it becoming something that is so near and dear to my heart and like talking in other places, we came across a lot of people that did not have that experience. That a lot of fathers that were in Brady's shoes that because they were concerned, and I'll say it because they were of our complexion, they weren't treated as kindly. And I guess I'll preface because I didn't say this. I have a Caucasian husband. They weren't given the same understanding that I think he was in those moments. We were fortunate enough to meet someone who spoke at a conference with us who unfortunately he lost his wife in a very similar way to me, and in him trying to advocate for her while on the table, he was perceived as threatening and removed from his wife and removed from the hospital when he lost her. And I think, like I said, location matters, but in the grand scheme of it all, medically, it shouldn't. It shouldn't matter that a father and a husband is concerned for their wife or their spouse. It shouldn't matter that their fear is coming across as anger. I think people should be able to perceive the difference between those things. And I'm fortunate that I had him, one, as an advocate, but he's a huge guy and people get intimidated. And I know he was intimidating, stalking those halls, wondering, am I going to come out of this room and what is going on? Because he was also asked to leave the room when I coded. So just to know that those two stories exist within the same communities, within the same realms, is just saddening and unfortunate because that didn't have to be their story.
Yeah. When we think about like your experiences, one, I was thinking, were there things that when we go back to the education piece, because you mentioned like your the itching, was
Yes.
that a sign of something?
Yeah, so that was a huge sign of cholestasis. And that's the reason I had those MFM appointments. And if I didn't have those MFM appointments, they wouldn't be checking the twins so regularly to know that, whoop, her fluid dropped and this heart murmur just showed up out of nowhere. And those appointments were weekly. So this developed within just a short span of a week.
Yeah, it's like all over itching, itchy hands, especially itchy feet. Your palms get super itchy. It's there are a few like warning signs of things. Like and you're just when your nausea just kind of continues. That's a warning sign. Like your blood pressure rising, the itchiness. There's a couple of things in pregnancy that you need to look out for. So when you do go to the doctor and they say is everything okay, that is the time when you have to like say those things that have been happening in the back of your head. And you're like, I want to speak up. Like
Mm-hmm.
because if you don't know, they do, and they can be like, oh, what do you mean you're itchy? Oh, let's
Right.
look at that. Yeah, it's really important to speak up when you're having those little things that you don't know that are a thing.
Now,
Mm-hmm.
that is a great point because Aaliyah, you mentioned you wanted to say something, but you
Yeah.
didn't. But
Yeah.
your husband did bring it up. What could help people feel more empowered or comfortable to speak up in a medical setting? Because it can feel like, am I
Yeah.
making a big deal of this? Is
Yep.
this something? Is it not? So, what are some
Yes.
things that could support people in those situations?
Having
I think
relationships with your provider. Go ahead, Aaliyah.
that no, that is exactly what I was going to say. I was seeing a practitioner or a practice that they wanted you to see everyone just in case on that day you went to deliver, it was somebody you had some sort of like, hey, I know you. I met with you a couple of times. And that was great in practice. But me seeing someone else every other week, I couldn't develop the rapport that I wanted to have with somebody to feel like, okay, I can tell you absolutely anything. And at that point, I felt like, yeah, I am. Maybe I'm just oversharing. Maybe I'm just itchy and that's normal. And it wasn't.
That's the care model for a lot of
Hmm.
OBs and midwifery practices in this area. Now, go back to what Aaliyah was saying. Like this area has really great providers. Like there are
Yep.
really great people that have a lot of experience. But the care model is to meet everybody, because you don't know who's going to be on when you go to deliver.
Hmm.
So 20 years ago, it used to be your OB would be at the hospital to deliver, but they've changed that because people were getting burned out. They had like the OBs have to be there when you deliver. So now it's a model of you meet everybody. There's maybe
Hmm.
one practice that delivers out of Sibley where there's a guy who follows his patients and delivers his patients. But having diverse, having people that look like you be your providers also makes you
Hmm.
feel more comfortable. But
Hmm.
the one of the problems is that your meeting with your OB or your midwife, your OB is like a 15-minute meeting. Your midwife you might get maybe 20 minutes. So you're especially in early pregnancy, you're getting one meeting a month. And then as you get closer, you're getting like one every other 2 weeks, you're getting one every week, but you're not spending a long time like building rapport with these people. So it all these things come into play when you're talking about like hiring a doula, someone who is going to be there 24/7 to answer your calls, spend an hour on the phone with you, like have these meetings with you where you can build this rapport and you can feel comfortable saying, "Girl, there's something leaking out of me. I don't know what it is. Can I show you?" Sure. Like send me a picture. So that's where it comes into play, where it's important to have somebody who can advocate and be on your side.
Hmm.
Now, when we think about your story, like, are there things that providers and support systems can learn from stories like this?
Yeah, I absolutely think so. I mean, even the fact that I had one birth prior and I didn't know that as Black women, I think the stat, and everyone can Google, I'm so sorry if I'm wrong. I think we're 64% more likely to experience pulmonary embolisms during birth itself and then for 3 months after. I never knew that. And I don't think a lot of us know that. So going into this, I'm thinking, okay, great, the twins are going to get cut out of me. The worst thing I'm going to have to deal with is now this scar and then breastfeeding and all these things. No, I didn't know that I actually could have died. That never crossed my mind to even prepare for or think about. And in a pregnancy like mine, where there weren't any signs, I didn't have any swelling of the legs, I didn't have anything that showed maybe a clot was present or anything like that. Even to have the awareness would have been great because did I sit too long? Did I not get up enough that period, that month, whatever, however long it took for the clots to develop? What did I not do that could have been, this is like you all said, preventable. All these things are kind of preventable, and knowledge is the base for that.
A lot of people think that when they hear the stats on Black maternal health, they think that women are dying in childbirth. It's
Right.
it's actually they're dying after. It
Mm-hmm.
is the time after is when a lot of these deaths are occurring, um, and not during. So I am constantly reminding people take your blood pressure once you get home. If you have I give all my clients like a sheet of like the warning signs. If you have any of these things where you're filling a pad, in less than an hour, like we have to go back to the hospital immediately.
Yep.
Like these are the things that we're looking for. Childbirth is scary, but it's beautiful and it's glorious and it's safe. But there are some things and some warning signs that other people don't know. But I was at a birth the other day, and the mom's like, O2 stats started dropping, and like I had to explain to her husband, like, no, we need to make sure she's getting oxygen, make sure her heart's beating the right way because there's something else that could happen to you after birth where your heart gets wonky and you got to walk around with a breathe with a breathing machine for a couple of months that way to get your heart back right. There's a lot of things that people don't understand that happen after you give birth that you have to look out for just to make sure you're okay.
Erin, you started sharing a little bit about like some of the things you do as a doula. Could you explain to us your role? Because you talked about like, I guess it feels like a spectrum of services, but what are some of the things that you do as a doula?
I am Erin. I'm a doula. As a doula, I am a support person. So I support moms, dads, families as they transition from being pregnant into parenthood. And that encompasses a lot of things. It means that I educate them on what to expect from the hospital or the birth location they've chosen. I educate them on what's happening in their bodies. I do childbirth education. I educate on breastfeeding support, and I also go with them during birth. So while people are laboring at home, I come to your home. I help your partner. I teach your partner how to keep you comfortable while you're laboring. I transfer with you to the hospital. And while we're there, we are laboring, we are advocating, we are educating, and we are working with hospital staff um, to make sure that you can get what you want as far as your birth desires and your birth plan, or we can get as close as we can to it. Um, a lot of times people think that doulas go into the birth space and we're argumentative, and our job is to go in there and be like, we're doing this, and you say we're going to do what we want. That's not the truth. Like, the truth is we work for our clients, and our job is to focus on what our clients need. Half the time I don't even talk to the doctors or the nurses. Like, I am more focused on, hey, is that what you want to do? Okay, sure. Sometimes I do have to interact with them, and building the relationships and being a pleasant person is very helpful. But my job and my focus is on making sure that my clients have the education they need to make their own informed decisions, and that they are being treated in a manner that keeps everybody safe. I also do postpartum work, meaning I go back after you have a baby and I make sure you're okay, and I make sure the baby's okay, and I help you transition. I help you and your partner work together as a team in the best way. I make sure you're sleeping. I make sure the baby's sleeping. I also teach you in postpartum, like, hey, here's how to birth a baby. Here's the best way to do this. And I also do placenta encapsulation. So if you want to encapsulate your placenta, I can do that as well. I do a lot of things. I'm a busy
But
lady.
thinking about like that work, because I didn't realize the risks that occurred after having the baby. In my mind, it's kind of like you have the baby, okay, the hard part is over. So it sounds like having a doula or someone that's continuing to educate you, or even those things you're saying around like, okay, if you're filling a pad by under an hour, you need to go back. I don't remember getting like a discharge. Here is what you need to know
People
when
are
you
here.
get home.
Yeah.
So the importance of like what you're doing in that space, it's like you're also constantly educating so that if something feels like it's not where it should be, people know what to do in those cases.
Yeah, I'm actually a former educator. I used to be a kindergarten teacher. So education is part of my job, and it's one that I take seriously, because it's like, if you overload people with too much information, they'll never remember it. So it's like I am a wealth of education, but I'm a wealth of knowledge, but I definitely hit the highlights of, here's what you need to know for this, here's what you need to know for that. And once we get to postpartum, here's the things that we need to look out for. I Another client I have just went back to the hospital because she has preeclampsia now after she had the baby. So, which it happens a lot. I have a lot of people that end up back in the hospital after the baby comes out. So these are all things that, there's literally a sheet they send you home with. That packet that the hospital sent you home with, open that folder, look through it. There are the warning signs are in there. The chart to track the baby's food is in there. The things that you need are in there. But a lot of people, they don't read it. So read it. It's in there. The information you need is there. Look at the warning signs. Be aware. Talk to your friends. Make sure you tell your friends, hey, girl, how much are you bleeding? Let's talk about it. Like, don't be afraid to talk about these things.
So as we think about, because part of this, we are understanding like this medical mistrust, we're understanding places where we need education, where things go wrong. We've even talked a little bit about like what support can look like. As we reimagine maternal care for Black women, what are some things from both of your experiences that we should be considering?
Oh, man. I think
Mhm.
it's such a big topic. For me, the two biggest things are always going to be education and then couple that with advocacy. I think, like Erin said, there's so much information that medical professionals have. And if it's a doctor, they're thing about doctors is they're very doctory. Like they're maybe not going to share it in the same way somebody like Erin would, where you're understanding it and it's said in a way that's really like colloquial to like how we talk and how we phrase things. It's going to be kind of said in this cold medical terminology. But finding someone that can share that information with you in a way that feels true to how we are, and it's broken down in a way that we can understand, is really important so that we aren't going into these big life events that have its pros and its cons, and it's things for us to consider, thinking that either one, everything is going to be okay, or two, everything is going to go horribly. Like, you need a balance to know that there will be things that can come up, and here's how you deal with those things when they do come up. Um, and then the advocacy portion, having anyone, and I said this, at the conference that I went to, let it be your best friend, let it be your mom, your grandmother, anybody, to be there and know your plan. And if you don't have the doula, like Erin, let them know your plan. I spoke to my husband about what I would want to happen. We even had the hard conversations, which is crazy, of if something does happen to me, this is what I want you to do. And while we thought it was a joke and it was so funny at that time, him having to play it all out in real time was insane. And I'm glad we had the conversation, because then he wouldn't have had anything to lean on to know she would want this, because it was the conversation wasn't had. Or for them to be able to communicate to your doctors and nurses, or just to know your wishes, is huge, because he pushed them off for so long on, I think we should wait. I think we should wait for this open heart surgery. And they listened to him, which is amazing. But just ensuring that you have someone that knows your plan, that can advocate for you and be confident for you in the way that you would advocate for yourself, I can't preach it enough.
Yeah. So I think one of the biggest holes is postpartum support. We spend so much time preparing and celebrating the people that are pregnant and that march to giving birth. And then we all kind of drop off for postpartum support. And that is the time when the birthing person, the support person, partner, that's when they need you the most. And they need um, evidence based information. The way we birthed 20 years ago is different than it is now. And I love my grandmas, but I am often like pulling them close, going, "Hey, hey, don't give baby water. Don't do that. Don't do that." And oh, and don't bug her about not doing this or that. Like let her let. I had to talk to a grandma the other day. I was like, "Hey, be easy, be easy." Like having wraparound support in postpartum, something we grossly mismanage in this country. The new like postpartum wellness centers are so beautiful, and they're standard in other countries. So like having somewhere for the parents to go to be supported by doulas, by lactation consultants, by people that have the information and can help them is so necessary. And being able to just be together as as a family is so nice. And if we could just get that like in a village model, you would see a lot less of like the postpartum depression, a lot less of the postpartum anxiety, the postpartum rage, the mental health issues that we're seeing from these traumatic births that are happening, from these experiences that are happening, these horror stories that are happening, and then transitioning into, and now you're a mother. Go and do it on 2 hours of sleep. Good luck.
Mhm. Mhm.
So many questions. So one, what is you said postpartum wellness centers?
Yes. So there's one in Tyson's. It's called Sanu, SANU, I think. And it's literally like a hotel where you go and you and the baby go, you and the baby and your dad go, and they have like a nursery for the baby to go. They have a spa. They have a chef. Like have like a restaurant where you can go upstairs and eat. They have lactation consultants. They have doulas. They have all the things you need. You can go for like a week or 2 weeks and just like hang out in your immediate postpartum and just be taken care of by all the people.
Oh, wow.
Yeah,
Okay. And I
very
think
nice.
one of that is very nice because as you think about that postpartum period, is like they kind of give you this baby, and especially for first-time parents, you're like, now what? I'm supposed to nurse this baby, take care of myself. I don't have enough time to sleep, keep the
Hmm.
baby alive, and it's a lot of things happening. And in the same way, we don't know all of the symptoms or signs of things that's happening with us. Sometimes you don't know what's normal
Don't.
for a baby either, an infant.
Yeah.
And so you're trying to manage all of that. Thinking of all of the things that are happening as we talk about maternal health, like how does that intersect with mental health? And you started talking about like postpartum depression, anxiety, rage, and I'm imagining mental health both before and after pregnancy. But how does that intersect?
very tightly. Um, I part of my job as a support person is to go back and do this meeting called the postpartum meeting. And we often talk about how the birth went, how you feel about it. What are some feelings that are associated with the birth right now? I mean, this is like usually a week after. And then I check back in maybe a couple months later, like, hey, how are you feeling now? Um, I have a lot of clients that experience traumatic births, and I always recommend them out to like a group, a therapy group, a therapist, just to make sure that they're talking to somebody, because your birth experience is something that goes with you forever. Like it's a story you will never forget. And if there is anything in there that like feels traumatic or feels off, or it's going to go with you and you hold it and it goes with you to the next birth. And it's really important that you process through that, because all those things like become part of a part of your mental health. It is very intertwined. If you have a beautiful partner and they were very supportive, you guys are so much more bonded in your marriage. If your partner was crappy and didn't support you and didn't squeeze your hips, divorce. So all the feelings around childbirth are very tied to mental health, and it is really important that you have support after you give birth.
Absolutely. I couldn't attest more. I think coming from our experience with the twins, I carried so much guilt after that. Obviously, none of it was my fault, but it's just guilt that you carry. I wasn't there for their first 2 weeks. I wasn't there to, all of these things. So I breastfed with my first, and I was so proud because that was a huge thing for me. And I wanted to breastfeed with the twins, and I couldn't. So I felt like my first got something that I wasn't able to give them. And there's guilt around that, guilt around the fact that their dad chose to be with me and not with them. So again, they weren't with either of us for that first couple weeks of their life. And then navigating that. And then on top of it, like you said, just trauma in general, you're moving past all of this. All of these things that have happened to you, your body is now totally different. Your mental, it's just not there. You're navigating looking different, feeling different, and just the weight of everything that you had went through on top of all of your medical bills are now hitting. So it's all of these things that are compounding on top of you. And it's like, wow, I survived this thing and I was brought through this thing. For me, I attribute all of it to God. And now, God, how do I stand in this and walk past it? How do I figure out all of those things? So
And you're now
having,
responsible for keeping these two babies alive. Like your
yes,
body, the body that feels like it got hit by a truck, is now responsible for keeping these two babies alive, and you don't have time to sleep. You have to
yep,
keep going. There is no
yep.
time to process what happened. It is go. You are a mom now. Deal.
Not at all. And with my first, I was very like selective. I don't think anyone came over our house out of respect for what I wanted for like a month. They came to see her, of course, but for a month, they gave me my space to do my thing. When I got home from the hospital with my twins, I was lucky enough to have already pre-planned for my grandmother to come from Trinidad to spend some time with me. But it wasn't just her. It was her. It was my mother-in-law. It was both of my brother-in-laws. And they just said, you go to sleep at night. They took the twins and they took Izzy and they figured it out. And again, I was incredibly grateful, but guilty. I felt so guilty for that. I felt like I wasn't mothering. So navigating all of that is so important. And like Erin said, not navigating it, because I tried to not deal with it for a while. That just hurt even more.
And I think this speaks to why these types of conversations are so important because you're going through all of the things, and a lot of times it could be in isolation, even if people are around you. But when we have these discussions, it sort of normalizes it, or other parents can, validate what you're experiencing and gently encourage you that this is what's needed in this moment. Because there's also this pressure that people, I don't know if it's self-imposed or society or maybe a combination of both, but like that you have to do all the things. And it was literally one of my line sisters came over and she said, people are going to ask you, what do you need? And you're going to say, I don't need anything, but here is what you need. And she gave me the list and it was like, oh, I need this script because I don't know. I would have said nothing because
Yep.
there's this pressure that we feel like I have to do all of it. And I just don't feel like successfully in motherhood, we're intended to do all of these things by ourselves. So I'm so glad we're having this discussion. Um, One of the things I wanted to, and we're going to open it up for questions. So if you have some questions, please let us know. But April 11th through 17th is Black Maternal Health Week. And their theme this year is rooted in justice and joy. So I know we've talked a lot about like the complexities of childbirth and maternal health and all of the things that can go wrong, but there's also a joy attached to this. And so I just wanted to hear from you too, like when you hear that theme rooted, what did I say? Rooted in justice and joy. What does that mean for you? With special emphasis on joy.
Yeah, I think it's huge because the joy portion, it's hard to get through sometimes. That postpartum is very real. But for a lot of people that are able to have the support to come out of it and come out of it in a stronger, more joyful manner, it's re-centering this idea that I was just dragged through childhood and like my spirit was dragged, my body was dragged, and I'm this totally different person. I think the joy comes in for me in when I look at those girls, man, after all of it, after processing it and getting through it and acknowledging that, okay, I look this way because I had two babies come out of me and I kind of almost died. And then I was really, really bloated because of all these fluids they were pumping in me. That is why, like, my body was able to sustain all of that to create them. And now watching them grow and develop and talk and walk and do all of these crazy things that they do, I have been able to shift and recenter my focus on like, I look this way because they're able to walk and talk and do the things that they do. And I might not remember, but maybe it's a blessing that I don't remember all of the intricacies that happened. So reframing the joy portion is huge to me because otherwise, I think for a lot of women and for myself, I would be stuck in this place that feels very confining and very like limiting. And we don't deserve to feel that way when so much of the world already wants us to feel that way.
Yeah, indeed. I love the joy portion of that statement. I also love the justice portion of it. We are in a time when um, access to health care, access to abortion care, access to prenatal care is under attack, and we have to seek justice for um our people that are in areas that don't have access to abortion care, and they don't have like the same rights that we do here in the DMV, and we don't have access to the same health care that we do here in the DMV. We've said before, in this area we have some great providers. We like Washington Hospital Center, um, some of my faves. Washington Hospital Center, like they have some of the best like OBs and midwives. And if I have any complicated births, I want to go there because I know that they're going to take care of my people and make sure everybody comes out alive. I was there the other day, and just know, let that go. But yada yada yada, the things happen in childbirth. The things are happening. Like people, the stats that you hear, they're happening. When I'm in these hospitals and the door opens and I see the cot go again, when I see things go by, I'm like, ooh, it's happening. It's happening. So it is really important that we continue to fight for justice in maternal health care, and we also celebrate the joy because it's not all doom and gloom. It's happening. It's not all doom and gloom, but people are having babies. People are having beautiful experiences. I often get to go to redemption birth, meaning like the first birth was something crazy happened, and I get to go to the second birth, and we have a beautiful experience. So beautiful experiences are happening, but also things are happening.
Thank you both. We have some, okay, so if you have any questions, please add them to the chat. There was one earlier around like, how do we get this information out to people? I lost it. Okay, how can we continue to advocate for and share this information more broadly and more consistently?
That's huge. I mean, I think you have great people who do the advocacy on their own as is because they're fueled out of their heart and they're fueled out of, connecting their communities and informing everybody. But I just wish more practices would be willing to, and in a way that feels, not fear-mongery, share it. Like, share what's going on, share what could be happening, share resources for people to tune into. Like, the National Blood Clot Alliance is something that is now near and dear to my heart. I didn't know they existed. I didn't know that was a thing until I went through something that made it evidently aware to me that this is a group of people that have found a community for themselves within, the world. And for us as Black women, I think being open to not only joining those groups and looking for those groups, but talking about it yourself. Because when you are open into talking about it, or you share your experience or your fears, you're opening a door for someone to say, oh, I didn't know I could say that out loud. Like, I didn't know that I could express those feelings to another woman, whether they look like you or not, because I thought they would judge me, or I thought my lack of knowledge would make them look down on me. Like, being open to engaging in conversation and putting those things out there. I kind of love to be like a troublemaker when I'm in spaces that aren't super Black. Like, maybe I'll say something that's a little problematic if we're talking about childbirth, and just see what's going on, see what people know, and if not, share what I know and just start the conversation that way.
Yes. I love doing that. I love just sitting back and going, "Ooh, is that what you heard? Tell me more,
Hmm.
please." I to your question, Nicole, I think that the way we have to get the word out on how to help everyone is by word of mouth. Um, when your friend is pregnant, when your niece is pregnant, when your cousin is pregnant, first conversation you need to have with them is, what's your birth plan? What are you where are you going? What hospital have you chosen? Have you looked up the C-section stats? Have you talked to your provider about what you want and what they offer? Have you hired a doula? What doulas have you talked to so far? Um, it is really important to have these conversations in your circle and not be afraid to ask the questions. Hey, girl, what hospital are you going to? Oh, I did not hear good things about that hospital. Have you looked at the reviews on that? Having these conversations openly at brunch, at in your spaces, at family dinners. That way, it becomes the standard and not the outlying. Um, I think everybody should have a doula. I'm biased, of course, but I definitely think that, especially a postpartum doula, especially somebody who can come into your home and normalize, the baby, popping on and off the breast, or normalize the fact that you don't have to get the baby formula before you leave the hospital. These are conversations that you'll never know because you go into these spaces with the mindset of, I'll just listen to the doctor. The doctor's not a lactation specialist.
Mhm.
They're not. They're not. They have lots of information about the baby. They're not specialists about lactation. They don't understand, what breastfeeding should look like. And they'll tell you sometimes. Sometimes they won't. Sometimes they won't. But you need to normalize these conversations in these spaces and bring in the right team of people to help you.
And we have two questions from the chat. So one is thinking about like, were there some ways that your experiences could have been prevented, or what are preventative steps we can take to help ourselves have healthier births and a healthier postpartum period?
For me, it's hard because I've talked to a lot of doctors to say, how could this have been caught? What could I have done? And a lot of my care team had told me, it's nothing that I could have done because there were no signs for me to notice. However, a scan to check for blood clots is a thing that they're not doing regularly. And I've asked, why is that not a thing? If we know, and if we know that it disproportionately affects Black women, I am that. So why didn't I get scanned? And it's apparently the answer is just it doesn't happen enough. Therefore, they're not willing to do it. So if I would have known that, like throughout my entire pregnancy, every question that needed to be asked, if I was too scared because I have this little mentality sometimes, I'd ask Brady to ask and he'd ask and we'd do it. Any testing that we wanted, we'd ask for it. So if I even had the information to know that scanning for a blood clot was something that we could have done, I would have asked for it. And then my delivery would have been very, very different.
Okay, this is a good question. So, as an OBGYN, it is a challenge to balance not making patients fearful about risk of birth or complications and giving patients the information they need to make informed decisions. From both of your perspectives, what would you have liked your provider to provide counsel that is rooted in facts and not fear? I know relationships matter, but they want your insight.
For sure. I mean, I had a lot of doctors that I think would have been more comfortable in having that conversation with me because they look like me. And I think, again, and I don't want to get into the conversation then of we're putting a lot of labor and unintentional labor on our medical practitioners who do look like us because we're kind of saying you can carry that weight of telling that person these things that could happen. But anybody should be able to say in a way that is affirming and comforting, hey, this is a risk. Not saying that this is something for you to be immediately worried about, but here are the things medically that we could do for you upon you asking that could alleviate that fear if that does arise in you. And these are all voluntary things that you can do. You can get a scan because you're disproportionately affected by blood clots and all of these other things, or you don't have to if you don't want to. And I think for me, because I'm just an anxious person, I would have been like, "Yep, scan me right now. Like scan me today, and then the next day, and whatever day before I give birth to scan me." But just giving people the option to make those decisions for themselves in a way that doesn't feel like I'm forcing it on you.
That part. Giving people the opportunity to make decisions on their own and not make it feel like you're forcing them to do it. The best advice I can give OBs is to stick to the facts. A lot of the I don't want to say I win, but a lot of the conversations that I have with clients, I win because I give them what the OB is going to say. So this is what the OB is going to say. Here's the facts behind what they're saying. Like, here's what they're saying. Here's the end of that sentence. Here's the entire research study of what they're saying. And I explain to people, like, this is the numbers behind what they're saying. And because those facts, people can make their own decisions. As a doula, I do not say, this is what I think you should do. This is what it is. A lot of times I'd be in these birth rooms and the doctors would be like, well, if I was your sister, I would stick to the facts. If you stick to the facts and you give people all the information and, not just, what happened to Susie Q 2 days ago and what trauma you're bringing into the situation from 2 days ago, you would win a lot more. You'd win a lot more. And sometimes OBs are on track. And like, I often go, okay, no, what she's saying is true. No, you see this baby's not doing well. Like often they always look at me like, oh my God, you're backing me up. Of course I'm backing you. You're right. But if you stick to the facts,
Mhm.
you don't try to push people into decisions, they would trust you more.
Absolutely.
I would just like to thank you both so much. This has been a very powerful discussion, and I feel like having both of your experiences, both lived and professional, and all of the things that you do. If you read the chat, so many people are talking about what they've learned today. And so this has been a great discussion, and I think it also gives us takeaways because even as people said in the chat, even if you're beyond the age of like you're done with having kids, people are already thinking about grandchildren or how are we having these discussions with each other. As Erin pointed out at brunch, we can have some of these conversations. What's your birth plan? What hospital? But we can also think about how are we expanding that beyond maternal care as well. As we talk about medical mistrust, having these conversations and safe people are ways that we can normalize the discussion. So thank you both so much. This has been an incredible and very informative discussion tonight. I do want to just say we have a evaluation of the program, and part of what we want to hear from you all is one, what you got from this program, but if there are other topics as we continue to think about health and wellness that you want to hear about or learn about, or we can think about future programs that would help us as well. And I'm just making sure. And so again, thank you all. That concludes our program, and good night.
Good night.
Good night. Wonderful program. Thank you.
Thank you,
Good night. Thank
Aaliyah.
you.
Thank you, Erin. Good
Time.
night.
Thank you, ladies.
Thanks. Good night, everyone.
Program.